Hi everyone, my name is Francisca Vasconcelos, and today I will be talking about UncertaINR, which is a framework for uncertainty quantification of end-to-end implicit neural representations in the medical imaging context of computed tomography. This work was done with my great collaborators, Whye, Nalini Singh, and Professor Whye, and will appear in the Transactions of Machine Learning Research in April 2023. With that, let's dive straight into the talk. I'll begin with problem motivation, background, and setup. Although we foresee many interesting applications of UncertaINR, in this work we chose to restrict our focus to the well-motivated medical imaging context of computed tomography, also known as CT or CAT scans. For those less familiar with the technology, I will briefly review how it works. To begin, a patient lies inside of a CT scanning tube, which consists of an X-ray source and X-ray detector that rotate around the patient. At each measurement view angle, the X-ray source emits X-ray photons, which are attenuated by tissues in the patient's body before being measured by the X-ray detector. If we perform measurements at enough of these measurement view angles, we can stack those measurements to form what is known as a sinogram image. This sinogram image is related back to the original patient cross-section image by a mapping known as the radon transform. It turns out, however, that learning the inverse radon transform, which is the key goal of CT imaging, is pretty challenging, especially in the real-world context of noisy, sparse measurement data. And that's going to be the focus of our talk today. In order to further motivate why we chose to focus on this specific medical imaging application, we will note that CT and other radiation-based imaging platforms are commonly used in medical imaging. Namely, over 70 million CT scans are performed in the US annually. However, there's an important imaging trade-off in this context. In particular, although more measurements improve image reconstruction quality, they also expose the patient to increased radiation, which can lead to harmful pathologies such as cancer. In fact, an estimated 29,000 current or future cancer cases are linked back to CT scans performed in the United States in 2007 alone. This thus leads us to our first algorithm goal, which is to achieve the highest possible image reconstruction quality with as few measurements as possible. Furthermore, we believe that uncertainty estimates can be used by doctors as an additional information source about reconstruction quality and therefore improve their ultimate diagnoses. In fact, we also believe that uncertainty estimates can be used to improve measurement collection via techniques such as active learning. This therefore motivates our second key algorithm goal, which is to achieve calibrated uncertainty quantification of the reconstruction image. With this background, we can now discuss our proposed pipeline for CT image reconstruction with uncertainty. This pipeline begins with sinogram measurement data, which, in the case of our experiments, is generated artificially from some sort of ground truth image. This sinogram measurement data is then fed into our proposed reconstruction algorithm, which has the standard CT imaging goal of generating a high-quality reconstructed image. However, we also have the important secondary goal of quantifying uncertainty over our reconstruction algorithm. In particular, we aim to achieve well-calibrated uncertainty quantification estimates. For now, though, we will focus on the first standard goal of how our reconstruction algorithm can go about generating a high-quality reconstructed image. In this work, we address the problem of image reconstruction via a recent yet exciting development in the field of deep learning known as implicit neural representations, or INRs for short. At a high level, INRs use neural networks as continuous function approximators. So, in the case of image data, the INR encodes the image as a continuous function, which is then approximated via a small neural network. This neural network takes as input an pixel coordinate and outputs an RGB value corresponding to that pixel. Therefore, in order to reconstruct a full image, one would simply need to sample the INR across all pixel coordinates. In the context of CT imaging, we can use these INRs to produce an end-to-end framework for learning a high-quality reconstructed image. The proposed reconstruction algorithm to do so is visualized on the slide. Namely, we use the INR as an encoding for the desired reconstructed image, and in each step of training, we take a radon transform of the sampled reconstructed image from the INR. This radon transform then produces a reconstructed or predicted sinogram, which can be used to calculate a loss relative to the true measurement data or measured sinogram. This loss can then be used to update the network parameters over the course of training until a high-quality reconstructed image is achieved. Now that we've proposed a reconstruction algorithm which can leverage INRs to achieve a high-quality reconstructed image, we will discuss how we can go about modifying that reconstruction algorithm so as to achieve well-calibrated uncertainty quantification estimates over the output image. We now propose UncertaINR, which is a reconstruction framework that not only achieves high-quality reconstructed images, but also is able to quantify uncertainty over the reconstruction performance. It turns out that UncertaINR does not differ too greatly from the previously proposed reconstruction algorithm. The key difference lies in how the INR is sampled. Previously, we sampled a single reconstructed image from our INR, but in the case of UncertaINR, we will now sample an entire predicted or reconstructed distribution of images. From this distribution, we can then calculate a mean, variance, and any other metrics that we might be interested in for quantifying uncertainty. In order to leverage a similar training procedure to the previous reconstruction algorithm, we will calculate the mean image of this predicted distribution, which is then fed into a radon transform to calculate a reconstructed sinogram that can then be used to compute a loss relative to the true sinogram and update the network parameters accordingly. The key question that then remains is how we can actually go about predicting a full distribution of images from the INR, as opposed to the previously predicted singular image. And the way that we go about doing this is actually by leveraging standard uncertainty quantification methods from the neural network literature and applying them to our INR. So in this work in particular, we focus on 4 of the main neural network uncertainty quantification methods, which are Monte Carlo dropout, Bayes by backpropagation, deep ensembles, and Hamiltonian Monte Carlo. I will now conclude the talk by going over our experimental methods, results, and conclusions. In terms of performance metrics, we wanted to be able to assess both reconstruction accuracy and model calibration. So to do so, we used 3 different metrics. The first was peak signal-to-noise ratio, or PSNR, and signal-to-noise ratio, or SNR, and these are both measures of reconstruction accuracy. The second metric we used was expected calibration error, which measures reconstruction calibration. The third and final metrics that we leveraged was negative log likelihood, which measures both reconstruction accuracy and model calibration. In our work, we performed 2 main experiments, the first of which was an ablation study leveraging the Shepp-Logan Data Set, which is an artificially generated set of 2D Shepp-Logan data phantoms that look as depicted on the slide. We implemented a number of baselines to compare the performance of UncertaINR2. These included a number of standard medical imaging reconstruction techniques, including filtered back projection, conjugate gradient least squares, expectation maximization, and simultaneous iterative and algebraic reconstruction techniques. Note that the classical reconstruction techniques struggled in very low measurement regimes, specifically the 5 and 20 view cases. Therefore, in our ablation studies, it was exactly these difficult regimes in which we chose to focus our experiments. In these experiments, we performed the first large-scale study of hyperparameters for INRs with uncertainty, once again in these very low data regimes of 5 and 20 views. We considered several hyperparameters. For the model itself, we looked at width, depth, activation function, and random Fourier feature frequency. For our uncertainty quantification methods, we implemented Bayes by backpropagation and Monte Carlo dropout, each of which possessed their own hyperparameters that we had to tune and hence why this ablation study was so useful and informative. Note that it was not computationally feasible to fully hypertune Hamiltonian Monte Carlo, which is why we left it out of this experiment. I will now present our key table of results from this first experiment. While there's a lot going on in the table, there are a few key takeaways from this first ablation study. From the line delineating the two, we can see that UncertaINR significantly outperforms classical reconstruction approaches. Furthermore, we see that Monte Carlo dropout as a means of uncertainty quantification significantly outperforms Bayes by backpropagation for UncertaINR. Finally, we observed that deep ensembles of 5 to 10 Monte Carlo dropout base learners achieved the best overall performance in terms of reconstruction accuracy and uncertainty quantification. In the appendix of the main paper, you can also find visualizations of the mean image, variance image, mean squared error image, coverage pixel-wise image, and reliability curve for each of our different approaches in the different view cases for some example Shepp-Logan data phantoms. And with that, we'll move on to our second and primary experiment, which is a comparison of UncertaINR with state-of-the-art methods on the challenging and realistic AAPM data set. This AAPM data set consists of abdominal CT scans provided by the Mayo Clinic for the American Association of Physicists in Medicine 2016 Low-Dose CT Grand Challenge. Note that we only used 8 hand-selected diverse images from the full AAPM dataset in order to enable fair comparison to existing baselines. We also introduced artificial noise to this dataset in order to make the reconstruction problem more challenging and realistic. Since the main goal of this second experiment was to compare the performance of UncertaINR to existing approaches, we once again compared UncertaINR to standard medical imaging reconstruction baselines. We used all the same ones as in the first experiment with the addition of the fast iterative shrinkage thresholding algorithm, which leverages TV regularization. In terms of state-of-the-art deep learning approaches that we used as a baseline, we also compared to FBP-UNet and GMRED. It is important to note, however, that these methods require substantially more training data than UncertaINR, so we do not actually expect UncertaINR to obtain as high accuracy of a reconstructed image as these state-of-the-art deep learning methods. However, this is a good baseline because if UncertaINR can perform comparably to these methods, it means it's achieving essentially state-of-the-art reconstruction accuracy. Recall that the key goal of UncertaINR is to obtain calibrated uncertainty in addition to this reconstruction accuracy, which is something that these SOTA deep learning approaches do not currently possess. And finally, we also compared UncertaINR to some of these previous approaches enhanced with another INR-based approach called COIL. Note, however, that COIL in and of itself is not an end-to-end INR approach. It is actually a pre-processing approach for all of these classical or maybe SOTA deep learning reconstruction algorithms. Essentially, what the COIL network does is it leverages an INR to essentially artificially increase the size of the sinogram that is then fed into these classical reconstruction algorithms to hopefully boost the performance from less training data. We performed several experiments to assess the performance of UncertaINR in and of itself. In particular, we implemented a couple baselines to determine whether or not uncertainty quantification actually improved reconstruction performance. To do so, we implemented baselines that consisted of essentially the original reconstruction only algorithm, in the first case leveraging an INR, and in the second case we implemented a baseline which actually dropped out the INR altogether and leveraged what we refer to as a grid of pixels. And so the key idea in this second experiment was to determine whether or not the INR was actually improving image reconstruction performance, or if we could get away with just using the image in and of itself, which would avoid the hassle of training and learning the INR. One interesting observation that we made in these experiments was that we found that in the case of both the INR and grid of pixel, using TV regularization, which is a standard technique in the medical imaging literature, substantially improved reconstruction performance. And to our knowledge, this was the first implementation of INRs with TV regularization. Given that it really helped to improve our reconstruction performance, we would recommend this for other people training INRs, even if they are not using uncertainty quantification. Now, in order to assess the performance of uncertainty quantification in UncertaINR, we also implemented several experiments. So the first was to determine whether or not the INR in and of itself actually helps with improving uncertainty quantification. And so to assess this, we implemented the grid of pixels with uncertainty. An important thing to note, though, is that a lot of the techniques that we were able to use for uncertainty quantification on the INR, including Bayes by backpropagation, Monte Carlo dropout, and deep ensembles, are methods that are specific to neural networks. Since the grid of pixels just represents the image as a matrix of values and does not leverage a neural network, we therefore could not leverage these uncertainty quantification approaches in the grid of pixels case, leaving us only with Hamiltonian Monte Carlo. For INR uncertainty quantification as a baseline, to see whether the UncertaINR framework was in and of itself useful, we tried just implementing a deep ensemble of pointwise INRs. So we essentially made a deep ensemble where each base learner in the ensemble was an INR without any uncertainty. And then we did deep ensembling over the outputs of each of those individual networks. Finally, moving on to the UncertaINR itself, we implemented UncertaINR with multiple uncertainty quantification methods. So we implemented UncertaINR with Monte Carlo dropout. We implemented a deep ensemble of UncertaINR base learners that in and of themselves had Monte Carlo dropout implemented. And then finally, we implemented UncertaINR with Hamiltonian Monte Carlo. I will now discuss the main findings of the paper as presented through the results in Table 2 from the main paper. There are a few key takeaways that I want to highlight. The first is that UncertaINRs significantly outperformed standard classical medical imaging reconstruction techniques. Furthermore, UncertaINR outperformed the grid of pixels reconstruction and uncertainty quantification. So this implies that using INRs can actually offer an advantage to standard image representations for both reconstruction accuracy and quantifying uncertainty. Furthermore, UncertaINRs outperformed standard INRs, which is a pretty interesting finding in that it says that adding uncertainty quantification to your INR for the training can actually improve the INR's reconstruction accuracy. Another interesting finding was that deep ensembles of Monte Carlo dropout UncertaINRs performed the best, especially in the low view setting. I guess this was a similar finding to what we saw in our first experiment in the ablation study. A really surprising finding that I want to highlight, and is probably one of the most interesting findings of the paper, is that Monte Carlo dropout generally outperformed Hamiltonian Monte Carlo. Now, the reason why this might be exciting is that often in the Bayesian deep learning literature, Monte Carlo dropout is seen as a very simple yet not highly effective technique for uncertainty quantification of standard neural networks. However, Hamiltonian Monte Carlo is typically regarded as a gold standard method for uncertainty quantification of neural networks, but is very computationally demanding and can oftentimes be hard to implement. So it's typically seen as a better but more challenging technique to use. What's interesting moving into the domain of INRs is that we actually see that the simple technique of Monte Carlo dropout is also extremely effective in this domain, competing with, even if not outperforming, Hamiltonian Monte Carlo, which is really nice because then it means that we have a simple, effective procedure for performing uncertainty quantification on INRs, which should reduce the barrier to researchers in general implementing uncertainty quantification on their INR experiments. And finally, as we noted in one of the previous slides, despite the fact that state-of-the-art deep learning methods require substantially more data to train than our UncertaINR approach, we found that UncertaINR actually had competitive reconstruction accuracy with these SOTA deep learning approaches, meaning that UncertaINR really is doing well in the reconstruction accuracy aspect, in addition to all that it offers in terms of uncertainty quantification and calibrated uncertainty estimates. I will conclude the discussion of results for the second experiment with a presentation of the final and main figure of the paper. On the left, you can see a figure labeled A, which is meant to reflect the benefits of Monte Carlo dropout for INR calibration. In particular, the plot is composed of several violin plots, one for each of the uncertainty quantification approaches, and these violin plots compare side by side pixel-wise distributions of absolute error versus standard deviation. And what we can see from these violin plots is that for non-Monte Carlo dropout-based deep ensembles, the standard deviation distribution skews towards smaller values than the absolute error distribution, which indicates to us that the model is overconfident. However, the opposite is true for Hamiltonian Monte Carlo-based grid of pixels approach, which is in fact underconfident. Meanwhile, we see that Hamiltonian Monte Carlo and Monte Carlo dropout based on UncertaINRs predict the standard deviation distributions most closely resembling those of the absolute error distributions, which indicates that those two approaches do in fact achieve decent model calibration. The picture on the right presents just a series of plots corresponding to each of the different methods for one of the 8 images taken from the AAPM data set for evaluating UncertaINR. So for each of our uncertainty quantification approaches, we present the reconstructed mean, absolute error, and variance image. We also present coverage histograms and reliability curves. Now, as I mentioned, this is just for one of the 8 images used in the dataset. However, you can find 7 other corresponding plots in the appendix of the paper itself. I will now conclude the talk with a few concluding remarks. Specifically, I want to give an overview summary of the project and some of the key takeaways. So, at a high level, we introduced UncertaINR, which is a Bayesian end-to-end INR framework. In doing so, we performed, to our knowledge, the first ever study of uncertainty quantification for implicit neural representations. This was achieved via a large ablation study, through which we found that Monte Carlo dropout, which is a simple and efficient method for uncertainty quantification, actually outperforms the gold standard Hamiltonian Monte Carlo, which is far more computationally intensive. We also found that UncertaINR achieves better reconstruction performance than classical medical reconstruction techniques, competitive performance with state-of-the-art neural networks, even though those SOTA techniques require substantially more training data, and better uncertainty quantification than pixel or voxel-based approaches. In terms of broader impact, we want to emphasize the fact that UncertaINR seems to perform exceedingly well in low data regimes, which is especially promising regarding that statement we made at the beginning of the talk, which is that CT image reconstruction requiring less data reduces patient exposure to harmful radiation. Another promising implication of UncertaINR is that we believe uncertainty can be used to inform doctor diagnoses by allowing them to view things such as variance images that will enable them to assess how well the reconstruction performed and get a better sense of whether or not they should be able to trust perhaps artifacts or things that they observe in the image that then will inform their ultimate diagnosis. And finally, an exciting avenue for future work is that we believe uncertainty can be used to perform informed measurement collection via techniques such as active learning, which can thus further reduce the amount of data needed to create high-quality reconstructions, thereby further reducing the amount of patient exposure to harmful radiation. And that's it for UncertaINR. Thank you all for watching. If you found this talk interesting, definitely make sure to check out our paper in the Transactions of Machine Learning Research, and also take a look at our project GitHub. Thanks.